I see you're on. Can you text Harold to see if he's going to be on time?
Yep.
Thank you. Oh, well, good morning, everybody. Welcome to our return to school, physically distanced school preliminary recommendations for the 2021 school year. For those who don't know me, I'm Rachel Monades, Assistant Superintendent of Continuous Improvement. It's so strange to be talking to a screen and not be able to see the lovely faces of our community and our students and our employees. So I will do my best to navigate through this environment that we are all in right now. And while we wait for our interim superintendent to join, we'll go ahead and pull up the presentation, and I'll just talk through just a little bit of that. First and foremost, for all of our participants, I want you to know that we are in what we are calling the input gathering stage of our initial recommendations. We have a team that was over 100 people that really dug into research and international and national models of what returning to school could look like since May 5th. And now that team is here to present those recommendations. And we want to get feedback from our community, including our students, our families, and our employees to improve upon the recommendations that we have found so far. So please, as you are listening to this presentation, know that no final decisions have been made, that your input is crucial to the success of the reopening of San Bernardino City Unified. And all of the information will be taken into consideration and then compared to what our federal, state, and local policy guidelines are saying. I think I'm going to keep going, and when Dr. Volkemer comes in, we will just pause and turn over the presentation for him to welcome. So without further ado, let's go ahead and move to the next slide. So it's really important for us to let our participants know that there are going to be places on the agenda where we are going to stop and present a question or a poll for our participants to respond to, and then we'll project the outcome of that information. And so when you look at the agenda, any place that you see that is underlined and bold, and you can see we have our whole presentation bilingual English and Spanish. Wherever you see underline and bold, we will pause for a few minutes and there will be a survey for you to complete. So we really hope that you are on a device where you can log into and complete the survey. That will help us to improve our preliminary recommendations. So again, there are 4 different places where we will be stopping and getting input from our participants. Next slide. So the purpose of this presentation, there are 2 primary purposes. The first one is to share key findings and recommendations from our physically distanced schools. You'll see that referred to as PDS, the teams of those schools. I'm sorry, let me rephrase. We're going to share key findings and recommendations from our physically distant schools teams. That's the 100 plus people that I mentioned, as we prepare for the start of the 2021 school year. And we want to gather input and additional considerations from you, our participants, as we prepare for the 2021 school year. So 2 key primary objectives of this presentation. Next slide. Before I do this check-in, I do want to share with everybody in the description on the YouTube page, there are some links in there. The links will take you to our executive summary of everything that we're sharing today. It's very detailed. The executive summary is both in English and Spanish. So that is a place for you to go to and get more detail on this presentation and what we found in the research that was conducted. And you'll also see the links to the surveys. So that's another place for you to gather information. Again, that's in the description links within the YouTube webpage. Okay, so I'm going to start first. We want to get a sense of what the community's feeling is right now about returning your children to schools. So you can do one of two things. You can copy and paste that link into your browser, or you can type it in yourself. But please take 2 minutes, go into that survey and let us know where you are in terms of your level of concern about returning your child to school, and provide us a comment. And so we'll give 2 minutes to do that. That should give everybody plenty of time. It's 10:07. We'll come back at 10:09. Let us know how you're feeling. Got 1 more minute for anyone who needs more time. Two minutes is a long time, isn't it? David, if you'll go ahead and present the results thus far. We can make that maybe a little bit bigger. I think I could read it and the colors are there, right? So I'll do it while we're figuring this out. So of course, you know the question was, what is your level of worry at this point about sending students to school for the next academic school year? And so the blue is very worried, the yellow or the red is somewhat worried, and the yellow is not worried. And so we can see half of our attendees right now are very concerned about sending your children back. That's really important for us to know. We're going to be doing this same question at the end, and some of your and so your response may change based off of what you hear. But thank you so much for sharing that. You can continue to add to the response. We're going to go ahead and go forward. Again, it is our hope and our desire to minimize your concern, because your children are our children and we want them all to be safe and healthy. That is why the schools closed down in the first place, right? So we will not do anything that is not in the best interest of children. Thank you so much. Let's go ahead and go back to the presentation. That's great feedback for us. That gives us an idea on where our community is right now. Next slide. So I know this slide has a lot of information on it. Making sure that our Spanish-speaking community are engaged is also a priority for us. So work with me on this one. I'll walk through it. So May 5th, believe it or not, it's been over a month that we pulled together this team of over 100 people. And my ask of them was to start researching what is out there in preparation for returning our students to school. If we were to return in a regular school setting, what do we have to be sure that we're doing and that we have in place so that our students and our staff are safe and healthy? Because first and foremost, we close schools because of a public health concern. So we want to make sure that when we open, we're adhering to that public health concern. That still continues to be the primary reason for why we're not back in school in a regular traditional setting. So that started May 5th. And when we first opened this presentation, you saw some of those people possibly on the screen. I want to thank Aldo Ramirez. You will hear from him later. He has been instrumental in helping the teams work through guiding this work, and you'll see some of the team leads as well. So those teams went through tons of research and guidance and newspaper articles, and you can't even imagine all the information that they've been looking at to come together and say what is in the best interest of our students and staff in San Bernardino. And they have drafted these recommendations. We currently now are in that input gathering stage. We're sharing this information. We've shared it with our employee groups. We're sharing it with you today. We have another live stream this evening where we're going to share this information. And so you can see we're only on step 3, gathering the input from our community to then improve upon the recommendations that we found. We will then finalize those guidelines. We will be publicizing the guidelines, sharing that at our next board meeting on June 16th. And then we will start, based off of direction from our board, preparing our facilities to have students enter whenever that may be, and then communicating to you as a community as to what this looks like. We will train our school teams, and our teams will also communicate with our parents. For when we do bring students physically back, how do we ensure that they are safe and that they are healthy? And you can see on the bottom of this timeline, along the way, we are always monitoring and adjusting guidelines that we get from the federal government, that we get from the state of California, and guidance that we receive from San Bernardino County Public Health. And so again, no decisions have been made. We are in preparation for when we return students to a physical school setting. That may be the first day of school, that may be months into the school year, but we are preparing so that we enter a space by which everybody is safe and healthy. And so I'm going to stop here. I just saw our interim superintendent, Dr. Harold Volkemer, join us, and so I just want to allow Dr. Volkemer to give some welcoming comments. Thank you for joining. I know you were on another call. There's just never enough time in the day. So Dr. Volkemer.
Thank you, Dr. Menarez. I appreciate it. Hello, everyone. I apologize for being a little tardy to this meeting. I was on another call with a community group, and they just had lots of questions, and I wanted to make sure that I answered them. So I do apologize for being late. I want to thank you very, very much for being here and investing your time with us this morning. Your participation is vital to our success in serving the nearly 50,000 students and families that are in our charge. And so we just want to say thank you very much for carving out the time to be with us this morning. We know that even though our 1920 school year just ended for your students last Thursday, you're already thinking about 2021, as are we. And so your voice is critical to how we plan for next school year and how that might take shape. And so we're here to hear from you, your preferences, your thoughts, your ideas. This is really your time. We're here to hear you. And so you've already gotten into the work, but I want to give a huge shout out to Dr. Menarez, Mr. Ramirez for leading this work. When I asked Rachel to take on this task a little over a month ago, it was completely crystal ball. It was completely projection and conjecture in terms of, well, what's it going to look like, and what's the health condition of the community going to be, and what is the guidance from the state and the county going to be? And they have taken a group of over 100 stakeholders and really given them a very, very nicely laid out process to follow to put us in the best position to open as effectively and safely as possible. They've been poring over all that guidance, seeing what it means to our operations in the district, and most importantly, and I really want to emphasize this, how it fits in our community. Because no matter what the guidance says, no matter what all the other school districts are doing, what we do has to fit for our community. And they've done, I think, a great job of preparing us to be able to do that in whatever form it takes. And so the work's not yet done. Your input will shape the final product, but that team deserves huge kudos for what they've been up to the last 5 or 6 weeks. And so with that, thank you. And again, a thank you to you for being a part of the discussions and the input this morning. I just want to say thank you again. I am actually going to jump right off of this call and drive right over to San Andreas High School for their drive-through graduation. So thanks for giving me a couple minutes. Look forward to seeing what you come up with this morning. Thank you.
Thank you, Dr. Volkermer. Travel safely.
Thank you.
Okay, so that's been the timeline. You can see we're very much still at the beginning. And at the very end of this presentation, we'll share with you immediate next steps, okay? So you don't need to worry about taking any pictures of this yet. The last slide you probably want to take a picture of. Next slide, please. So I shared in the beginning that our first and foremost, we have to make sure that our students and staff are healthy and physically safe. So we have 4 guiding principles that we're using when we think about and we make decisions about or recommendations, or just as we review all of the research and the guidelines that are out there. How do we design learning environments that are, 1, keep students and staff healthy and physically safe, environments that, 2, adhere to the Center for Disease Control, the governor and San Bernardino, the governor's guidance, and the guidance from San Bernardino County Public Health. We have to make sure we're adhering to all of that. So that's the federal, the state, and the local guidelines. Those are 2 very important principles that we're using as we think about what opening our schools can look like. Third one is, of course, because we are a learning organization, we are a school district, we want to continue to provide high quality learning experience for all students. We know when we entered into distance learning, we had to pivot very quickly, and we did. We moved the system rapidly into a 100% distance learning. Our teachers got trained, our students got devices, but even in all of that and all the success we have, we know that there are areas for improvement. And so we want to continue to improve upon what we learned and continue to offer high quality learning experiences. But first and foremost, we have to make sure our students and staff are safe and physically healthy. So what you're going to hear today are the recommendations around, number 1, keeping students and staff healthy and physically safe. Number 2, adhering to Center for Disease Control, governor, and the county guidelines. And number 4, it is our responsibility. We are an employer of over 7,000 employees. We have to make sure that we provide safe and accessible working conditions. So today you will hear most specifically about our guiding principles, number 1, 2, and 4, because this is around how we make sure our students and our staff are physically safe and healthy during this COVID-19 pandemic. Next slide. And so I'm going to turn it over now to Aldo Ramirez. Again, Mr. Ramirez has been instrumental in working directly with our team leads, and our team leads have been leading large groups of teachers, of classified staff, of principals, of all the different entities that are going to have to make this work when our students do come back, whenever that may be. And so with further ado, thank you, Mr. Ramirez, for your brilliance in leading this work. Please introduce our planning team members.
Fantastic. Thank you very much, Dr. Monarez. So for everybody, once again, my name is Aldo Ramirez. I am the Director of Continuous Improvement, a proud parent of a graduate of San Bernardino High School in 2019 and parent of a current student in the district. So this work is very near and dear to my heart. As Dr. Monarez mentioned, a team was brought together in early May, a very large team, and we're very grateful to all of them and all of the work that they have done. During that time, there was only a little bit of guidance from the federal, state, and local entities to go off of. What this team did as a result was to pool their collective professional knowledge and really think about all of the aspects that this pandemic impacts. And so they organized all of that knowledge into 9 categories of research. And so what you see on the slide are the different teams and the brave individuals that stepped up to lead those teams. These 9 categories included a focus on after-school programs and family support, and this was led by Maria Jauregui. Our focus on transportation and the implications for transportation, and this was led by Greg Perez. Also a focus on mental health and wellness, led by Colleen Williams. And in terms of safety, there was a team focused around screening and physical health implications. That was led by Shannon Flores. We also looked at our educational structure and options during this time. Dana Jamison led that work. A team led by Ramon Velasco looked at what the cost implications and the attendance implications are for our district as related to physical PDS schooling. Mario Jaquez led a team that looked at the importance of training and communication throughout this process. We found very early on that a lot of the guidance was leaving out this very important concept of training and communication during routine changes, and as we try to protect and provide a healthy work environment. Our team started looking at that from the beginning. Doug Metford led our safety in terms of cleaning and sanitizing and the best practices for that. And then Tom Pace led a team looking at the physical layout aspects of the work. Very thankful to all of them. Next slide, please. And so I want to reiterate that the team relied mainly on 3 sources of information. First was their professional knowledge, knowledge that comes from the work that they do on a day-to-day basis and that they've acquired over time and experience. Also, knowledge on research. And this is what this slide is mainly about, this dive into the research coming out from major entities, from national, international, and local as well. Lastly, the team also looked at positive outliers. Those are examples from around the nation and around the world that have successfully navigated the spread of infection. And they've compiled all of these things into research findings and preliminary recommendations for all of us to consider. Some of the major institutions that we relied on in order to pull research from include the California Department of Education, the Center for Disease Control, the National Association of School Nurses, Cal OSHA, CASEL, San Bernardino Public Health, and EPA, the Environmental Protection Agency. Like I said, these are just a few of the very many that we looked at and that the teams looked at. Now, we're super glad that we get your feedback on the work and the perspective of parents and students. We strongly believe that this will make our system stronger as we move forward. It is a very needed component. So thank you for your participation thus far, and we really look forward to getting your thoughts and ideas. As mentioned earlier, there's an executive summary available in the description of the YouTube page. It's both in English and in Spanish. And that's for those of you that want to go much deeper into the findings than what we can do here today in this streamed presentation. I do want you to please note that there have been some updates from CDE that have just come in yesterday with additional recommendations that would update what we have put out in that executive summary. As a district, once again, we strive to go with the measures that keep students and staff safe, and we'll incorporate the additional recommendations in the planning as they become available, just as they have become available through CDE. Next slide, please. So let me briefly go through the major areas of focus that the teams looked at as they did their work. Our education structure team looked at different options and models that are available to us during this time and considered what the pros and cons are of each of those models and laid them out for us all to consider, as well as started looking at sample schedules for elementary and secondary schools and made some preliminary findings in those areas. Our safety, the focus on cleaning and sanitizing team, looked at the best ways to reduce the spread of COVID in terms of hand washing and hand sanitizers and what the recommendations are around that and compiled that information for us. They also looked carefully at the recommendations around cleaning and disinfecting and have produced research findings in that area and provided some recommendations. In terms of the physical layout, the team looked at our facilities, average size of classrooms, and drafted different types of seating arrangements that would allow for physical distancing. They also looked at recommendations on how we can physically guide students and staff to ensure that there is little intermingling and reducing of the spread of the disease. In addition, they looked at what the implications are for visitors and for sharing of materials, as well as the use of physical barriers around our campus to continue to provide safety to students and staff. Next slide, please. The transportation team looked at what the implications are for our busing and also recommendations for those students that are walking to school during this time and could possibly be coming back to campus. They looked at what that means for seating, what that means for physical guides to help during transitions on and off buses and while on the bus. They also looked at what best practices are for cleaning, screening, and using personal protective equipment while on a bus or boarding a bus and exiting a bus to help keep students safe and staff safe as well. Our mental health and wellness team looked at what the supports that adults need during these very difficult times and made recommendations around those areas that we'll talk about shortly. They also looked at what supports students would need during physically distanced school and compiled research around that topic. Our communication and training team, as mentioned earlier, was a little ahead of where everybody else was in terms of guidance. And they looked at communication methods that are effective during situations such as these, as well as training strategies that will help ensure that we have the most thorough training of students, staff, and family on the different procedures and routine changes that will be needed in order to maintain everybody safe. Next slide, please. Our safety team that looked at screening and physical health really focused on providing us information around what needs to happen for vulnerable populations. What are the options that need to be put in place so that we can keep them safe? And this is very important because we know this is a major worry for a lot of our community members. What are we going to do for students and staff who are predisposed to the COVID virus and to its most detrimental effects. And so this team looked at that very closely. They also looked at the technical guidance and recommendations around using personal protective equipment and the technical guidance around distancing of students and staff if they come on campus and when they come on campus. Lastly, they provided a deep dive into what the best screening procedures are while at home, while entering the campus, and the monitoring procedures when students are on campus and staff, so that we can ensure that we catch any possible students and staff who may be infected and showing symptoms early, and place them in a situation where they're away from others, and that they can go home and then be taken care of through that means. Our after-school program and family support looked at what are the implications would be for our sports and VAPA and other after-school programs in terms of seating, physical distancing, using physical guides, as well as, and very important, what supports and structures we can use to help families during this time, and especially for our foster and homeless students who this can be an additional stressor for their experience. Lastly, our cost and ADA team looked at different funding sources available to us in order to help us implement many of these recommendations, and they continue to look at implications in terms of costs currently, as well as what the state is saying about our attendance and ADA and future funding implications into the following school years. So these teams have taken quite a bit of time, looked through a lot of research and a lot of entities, examples, and guidances to really build a base of understanding around each of these areas. Next slide, please. What we would like at this moment is to take a pause and for you all to please use the link available in the description of this broadcast, or by typing the URL present on the screen into your browser, so that we can collect your thoughts and incorporate them into any further research that we might need to do as we prepare for the physically distant school scenario. So we are asking for you to provide comments to us, and therefore we're going to keep an eye on the amount of information that is being brought in, and we have allocated 5 minutes for you to give us feedback on this research portion and your comments and ideas. After the 5 minutes, we'll come back and we'll start going over the recommendations section of the work that we have done. So please take a moment and provide us your feedback. team, we see that the responses are coming in. David, in a minute, if you could switch over to our pie chart so that our participants can see the responses that are coming in. And we will come back to the presentation at 10:39. So once again, we want to thank everybody for providing your feedback on this section. One more minute, team, and we will come back to the main presentation. Thank you for all of your responses. Okay, David, thank you so much. It looks like we have quite a few responses from our participants. Please continue to add to those as we move on to the next part of the presentation. So next slide, David, please. So a team will look at the information that you are providing. We're also looking at information from randomly selected families from across the district that we are conducting a survey with, and a couple of staff surveys to help continue to add more thoughts and information to our work. I'm now going to turn it over to a few of our section leads who will go over the preliminary. And I want to stress that once again, preliminary, as we seek to adjust those based on the information we get from you and our staff. After this presentation, we will once again get your feedback around the recommendations portion through a survey. Just for your background information, the recommendations are actually organized into 6 steps for SBCUSD to prepare for the PDS, for the physically distanced school. So in presenting these recommendations, we'll first start off with Shannon Flores, who will go over steps 1 and 2 in that preparation. Shannon is a nurse with SBCUSD. Team, as you come on to present your sections of the recommendations, please make sure you introduce yourselves and your role in the district. Next slide, please. So I'll hand it off to Shannon.
Thank you, Aldo. My name is Shannon Flores, and I'm a school nurse in San Bernardino City Unified School District. So for the preliminary recommendations, the use of personal protective equipment, also known as PPE, and maintaining social distancing, which is spacing of 6 feet apart, which we will need to have an adequate supply of PPE for staff, students, and the health office in order to return safely. For the medically fragile or vulnerable population, a requirement for medical consultation for staff and students prior to returning to school would be necessary. Guidelines for staff to follow and training regarding vulnerable students at school and distance learning teaching options would be made available as needed. And having a place on campus at each school site to isolate any potential positive COVID-19 cases. The incident management team, also known as IMT, would be needed to maintain regular communication and coordination with local and state health authorities, ensuring that reopening plans are in line with the state and local orders. Next slide, please. And we would implement a procedure that enables staff and students to self-screen daily regarding the COVID-19 symptoms. IMT has developed a self-evaluation questionnaire which can be used prior to arriving at a school campus. We would also implement temperature checks upon arrival to school and encourage staff and students to stay home when sick. Thank you, Aldo.
Next slide, please, David. So this slide covers the personal protective equipment, including the face coverings, and also the importance of social distancing and doing everything we can in terms of procedures to ensure that students and staff are remaining 6 feet apart in all situations within the campus. Next slide, please.
My name is Tom Pace. I'm the Director of Facilities, and as a father of students returning this fall to school, one of my main questions is how are we going to maintain social distance within our schools? And I'm hoping to demonstrate that to you now. We hope to keep our students socially distanced by modifying our classroom layouts, by reducing the capacity of our buses, and by encouraging social distancing through the use of physical guides. Next slide. To help ensure student safety, we plan on utilizing physical barriers and by separating students' belongings from one another through the use of cubbies or totes or plastic tubs. Next slide. Another crucial step in keeping our students safe is by limiting contact from non-essential visitors, volunteers, and other activities, and by seeking virtual activities in lieu of field trips and other large gatherings within the district. Next slide.
Good afternoon. My name is Dana Jameson. I'm an elementary principal at Muscoy Elementary, and I'd like to go over some of the instructional delivery model options. So due to the variety of instructional scenarios and schedules and their implications to all stakeholders, our team's recommendation and the decisions made need to be a collaborative process with the bargaining units, the students, staff, and families to decide the structure for physical distancing and the instructional scenarios. The first instructional scenario would be schools reopen in full distance learning mode. And that mode would include the continuation of asynchronous and synchronous learning. And it would also, we would focus on a soft opening to build those teacher-student relationships. The next instructional model would be the schools reopening in a blended or hybrid format. We would like everyone to take into consideration the account that younger learners and special education students would benefit from more face-to-face instruction, while older students can work more independently. Please keep in mind this blended format has many options of schedules, and we would also like to focus on a soft opening to build teacher-student relationships. The last option would be that schools reopen in a traditional format. Please be ensured that SBCUSD is committed in working collaboratively on all options that will meet the needs of students, staff, and families. And the next steps will be to work on specific schedules and instructional options. Thank you.
Next slide, please, David. And so this slide really highlights that what we're shooting for is a collaborative process where we provide options for our different families and their scenarios as we move forward, options that are safe. Next slide, David, please.
Good morning. My name is Doug Mefford. I am the maintenance manager for the San Bernardino Unified School District. And our team got together and we came to the determination that washing your hands with soap and water is the #1 recommendation for preventing spread of the disease. Our team's recommendation is to place portable hand washing stations around our campuses to assist with regular opportunities for our students and staff to wash their hands. We also recommend the utilization of hand sanitizer in locations where sinks are not available. The district will implement routine disinfecting of all high touch points, door handles, poles, light switches, and countertops, as well as daily disinfecting of classrooms. We also recommend the purchase of electrostatic devices or a similar product to apply the disinfectant in a more efficient manner. These devices reduce the time staff members have to be in each classroom or office while applying the disinfectant, so we can ensure better coverage for our schools.
Good morning. Colleen Williams, the Director of Student Wellness and Support Services for our district. Our component is about mental health. We know that the stay-at-home orders and the social distancing requirements have been difficult for families, students, and staff. So to proactively address those mental health needs, the district is planning to provide opportunities for staff and students to reconnect through social emotional learning lessons, coping strategies, and relationship building. Provide mental health first aid training for our site leaders and our department leaders to support our staff who have also been affected by stay-at-home orders, and provide a similar training regarding students to our staff to support student mental health concerns as well. Address our student concerns and anxieties around first being at home and now returning to school, and then continue the referral process for any additional staff or students needing interventions or supports. Thank you.
Next slide, please. Yeah, there you go.
Good morning, everybody. My name is Mario Jaquez. I'm the principal at Kimbark Elementary School. For us, we all know that there's going to be a lot of new procedures and protocols and information that needs to be shared with students, staff, parents, community members, everybody involved. And so our #1 priority is to make sure that everybody has the information, that they have accurate information. And so our goal is to make sure that all members, students, parents, staff, everybody is trained on these new protocols. And so one of the ways that we recommend doing this is by providing clear information in an easy to access place. And so one of those recommendations is through the SBCUSD physically distant school website that we would use as a central hub to share all of that information out with all of our community members. And then making sure that we have a physically distant school parent student handbook in both digital and physical copies. Making sure that all of our sites have virtual orientations. So our students that are transitioning from elementary to middle school to high school, or any special programs would be able to receive orientations, but they'd be able to do it virtually. And then making sure that we train our staff virtually using the same methods that we use in the past, our Google Classroom, the online programs that allowed our teachers to receive all of the trainings. We'll be able to provide that for all staff members, students, and community members. Thank you.
Next slide. Thank you. So thank you very much to the team leads who are working on those recommendations, and now looking at scoping out the work for making some of these pieces happen, and any additional things that might need to happen as a result of the feedback from our students and family. At this moment, please use the link available in the description section of the broadcast or by typing the URL present on your screen so that we can collect your thoughts to incorporate them in further development of action steps for physically distanced schooling. Please take 5 minutes. It's 10:51 right now, and we'll come back at 10:56. David, if you could show the graph 2 minutes into the 5-minute piece. Thank you. one more minute, team, and we'll come back to the presentation. All right, team. Thank you for all of your feedback. It looks like we have quite a few responses and appreciate the information that you're providing for us. David, if you can go over to the slide. Next slide, please. So team, we want to assure you that we're going to take this information critical that you are providing and look at our plans and ensure that the next steps are thorough and well thought out processes that will lead to very well implemented routines. What I want to do now is provide for you a sample of what a day in the life of a student who might be going back to school to a physically distanced environment could look like. So we'll start off first with the first thing in the morning that a family would do would be to as the students wake up, to do a quick symptom check to see if they're exhibiting any of the signs of COVID. And they would use a guide provided by our district to assess whether any symptoms that the student might be having could be related to COVID. And if they are, they would be encouraged to stay home, reach out to their school to coordinate work from home for the student, as well as the school may provide resources around supports through our county health department available for such cases. If the student is not exhibiting symptoms, then they would engage in their normal morning routines at the home, whatever those may be, in preparation for school. The students, before leaving, would put on their face coverings, and the families would remind them about the steps to take in order to be socially distanced as they go to school. This, once again, would be a guide provided by the school that they could utilize and reference. Next slide, please, David. As the students walk to school, they would be socially distanced based on the recommendations from their family members. And also they would be socially distanced as they board the bus to school if they're riding the bus. Once they get to school, they would be screened by staff members for any visible signs of COVID-19, as well as temperature checks, as mentioned earlier. Once inside the school and in the classroom, the teachers would also be monitoring for the onset of any symptoms. So maybe students start getting sick while at school. The teachers would notice that, and then they would be referred to the school's health office, where they would be kept separate from others so that they don't put others at risk. Families would be contacted and provided some of the county resources to help them with this possible scenario. Our IMT team would also contact county and let them know that a possible case has emerged. While in the classroom, the students would be physically distanced, so there would be less students in the class. And you can see a few pictures here of different configurations that they might experience. So less students in the classroom and 6 feet apart as much as possible. And if it would not be possible to keep them 6 feet apart, then they would have plexiglass partitions to help mitigate the spread of the disease. Next slide, please. During the day, the students would transition using guides, physical guides, to help them, lines on the ground, lockers and high touch points would be visibly marked as no touch zones to help the students with the process of transitioning. Some of these transitions might be to the frequent and structured hand washing, which may occur in the bathrooms or through the portable hand washing stations available to the schools that would be provided. Some of the transitions might be to the physically distanced lunch scenario, which may happen in the cafeteria with small groups of students and cleaning in between, or which could happen in the classroom, eating in the classroom as a already physically distanced classroom. Or it could be a grab and go lunch if the students are on a half-day schedule, to maintain that reduction in possible spread. Next slide, please. As the end of the day nears, the students would come back if they're bus riders to a newly sanitized bus and follow the guides available to them to maintain physical distance. The students would also walk home in a physically distant manner, reminder at the end of the day to them about what this looks like and the precautions they need to take. If the student is participating in extracurricular activities such as sports or VAPA programs, those programs would be structured in a physically distanced model. As you can see here, you would see students far apart doing exercises that do not require physical contact. And we are closely monitoring CIF approvals and recommendations for sports that do require physical contacts, and we'll be working closely with them and slowly transitioning, if allowable, into that kind of activity based on what is going on with COVID. Next slide, please. So hopefully that gives you an idea of what the day and the life of a student could be when they're physically coming onto a campus. We would like to take a moment for you to provide your final feedback at this point. So we hopefully the concrete example gives you a good idea of what things could be like. And we really would like your feedback on the different options as well. So if you could take 3 minutes to use the link on the screen or the link in the notes section and provide us where you're at with all of the recommendations and findings that we've provided for you today. So we will come back at 11:07. David, after 2 minutes, if you could please put the bar graph on the screen. All right, team. It looks like our responses are still coming in. Let's give it one more minute to make sure we give everybody time to respond and reflect. All right, David, if you could bring us back. And I would like to thank all of you for all of your responses. Really appreciate it. And I'm going to hand it over to Dr. Monarez, who's going to go over the next steps.
All right. Well, thank you, Mr. Ramirez, and thank you, community. Rest assured, we aren't only going to look at what you just saw in terms of the pie charts, but we will be reading the comments so that we can further improve upon the recommendations to increase your confidence and making sure that your children and that the staff are safe and healthy. Please know that in any recommendation that's done, we will still always offer some type of virtual setting for any family that wants 100% of their child's day in a virtual setting, meaning you want to keep your child at home and you want the district to provide the teaching and the learning through the internet online. That will always be an option, regardless of what we move forward with as a district as a whole. And an individual family can make that request, and the school will provide that for them. They will work with the district office on that. So please know that that will always be an option in these very unprecedented pandemic times, okay? So let me go forward with what's next. And this is our very last slide, so we're almost done. So step one is we are, as I shared at the very beginning, we're gathering feedback, and we will be revising our preliminary recommendations as appropriate. And when I say as appropriate, we have to be sure that we are adhering to the federal, the state, and the county guidelines. So we can't do something that's outside of the guidelines, and we want to make sure that we are keeping in concert with most specifically the county on what we are offering. So there might be some recommendations that come very clearly from our community and our staff, and then we would go to public health and we would make sure that we can indeed do that. So as appropriate, because we are not the final say when it comes to health concerns, that's our county public health, but we work very closely with them around this pandemic. So your feedback will be read. Anything that we're not sure if that's allowable based on county, we will work with county to see what we can and cannot do. But our goal always goes back to that principle of safe and healthy students and staff. The next step two, and this is an important date for you. So next regular scheduled board meeting, that's June 16th, that's next Tuesday. We will present the reopening recommendations. So by that time, we will have taken the input that we received from you today, the community members this afternoon, the families that we've called home to see where they're at, and our employees. So we've got lots of different input sessions that we're conducting right now, and we will share the recommendations from all of that on June 16th. So please tune in to the June 16th board meeting so you can hear the recommendations that are presented. From there, we will develop a frequently asked questions for family, or an FAQ for families document, and we'll be posting that on the SBCUSD Ready webpage. SBCUSD Ready, that is our COVID page. So that's our page that shows everything related to COVID, and that's where we will add all of our information on reopening schools. So everything will be updated and posted there. We want to schedule a follow-up meeting with you, the community, in late June, and we want to do that because we want to circle back with you and share with you the changes on the recommendations based off of the feedback we're getting from you and all the other stakeholders that we mentioned. And so it's just to share out, just so you can hear where your voices were reflected in the decisions. We don't have that date scheduled yet. We think late June, possibly early July. Just please follow our social media, and we'll do the same thing where we do our roll calls and all of that to let you know when we will have that follow-up meeting. It'll probably be about an hour's time. Again, just to share with you where your voice was heard and where it's represented in the recommendations. And then last but not least, what you did hear a lot in the recommendations is a need for training of our school staff. And not just our staff, it's going to be training of our staff, so our teachers and our clerical staff, our custodians, our bus drivers, but it's also going to be training for our students. Some of you may be thinking, I have a new kindergartner going into school. How are you going to train my 5-year-old on frequent hand washing and how to do that and how to stay separate from their best friend? And you know, that's what educators do. They're really good. We're really good at being able to teach children how to do things in a particular way and the reasons why. And so training for everybody is going to be very important. So we will be asking each school to develop their own teams at their school, because what happens at Cajon High School is not going to be the same thing that happens at Arroyo Valley High School. And there's a reason why. The schools are very different in structure and in setup. And so we have to have the teams really work through what this looks like at their particular school. What happens at Del Rosa Elementary School and what happens at Chavez Middle School are not the same. So these school teams will be instrumental in making a school physically safe and healthy for their students, their families, and the staff that they serve. So training of those teams is going to be very important, and we will be working on that during the summertime. So those are our immediate next steps. Some really important dates for you. The important date is the June 16th board meeting. That's next Tuesday. Watch for the frequently asked questions for families. We'll have that up on the webpage within the next 2 weeks. The reason that it's not going to go up right away is because we need to be sure we're ready for, one, we've got to take all the feedback from everybody. We need to get ready for the board meeting, and we're going to start getting our principals trained. But within the next 2 weeks, we'll have that FAQ up for you based off of what we get from our feedback. And then watch for social media postings or listen for phone calls on when our community meeting in late June will be. And so with that, I want to thank you. This is the part of the virtual setting that I dislike the most because I can't see you. I can't greet you and tell you that we are so appreciative of you, that we love your children dearly. We miss them greatly. They bring such joy to our lives as they do to yours. And this has been definitely a trying period for all of us. So please go and hug your children for us. Tell them that their teachers and their principal and everybody really miss them, that we wish them a safe and happy summer. Remind them that they need to read, they need to get out and exercise, they need to practice their math, and they need to just continue to think critically as the brilliant children that they are. Thank you for your time and your commitment to San Bernardino City Unified. It is through the partnership that we've been able to really thrive in these very challenging times. We know it hasn't been perfect, but we also know that because we are a strong community, we've gone through it with relative ease. So, and finally, I want to thank the team that has really led this work. I know it's been a huge task and we've received tons of information. So thank you once again for your dedication to the children and the families we serve. And with that, I wish you all a great afternoon. Please share with your peers that there is another repeat of this opportunity tonight at 6 o'clock. And so have a great afternoon. Bye.